8 silent symptoms of anemia you shouldn't ignore. Did you know that approximately 1.6 billion people globally suffer from anemia? The World Health Organization estimates that 42% of children under the age of 5 and 40% of pregnant mothers are anemic. Even worse is the fact that most people who are anemic are unaware that they are anemic, and that there may be serious consequences associated with it. Thus, we'll inform you about the silent signs of anemia that you shouldn't overlook in this video. Without further ado, let's get started. Number 1. Paleness of the skin. Because our skin is the most visible part of our body, it often communicates with us through signs about how healthy it is or whether something is wrong with our bodies. Healthy skin has a pinkish hue and a healthy complexion because it is receiving enough nutrients and oxygen from the blood capillaries that lay beneath the skin. However, if your skin appears dull and lifeless, it may be a sign of anemia, which occurs when the skin cells in your body do not receive enough blood or oxygen. Anemia signs can also appear in the gums, lips, lower eyelids, and nails in addition to the skin. Therefore, you shouldn't disregard anything similar you've experienced recently, as it can be a subtle sign of anemia. Number 2. Pica syndrome. Severe cravings for non-nutritional foods like baking soda or ice can also result from a significant iron deficit in the body. In addition, some people have appetites for things that aren't food, such as dirt, paper, chalk, and ceramics. We call this ailment pica syndrome. In addition to typical anemia symptoms, children and pregnant women are more susceptible to acquire this condition. Consequently, you should be aware that if you are experiencing comparable urges, it may be a subtle sign of anemia that you should not disregard. Number 3. Frequent tiredness and fatigue. If you frequently feel lethargic, drowsy, or exhausted, it may also indicate that your muscles aren't receiving enough oxygen or energy to remain active. The red blood cell's vital component, hemoglobin, is in charge of carrying oxygen throughout your body. Iron deficiency anemia and other related illnesses can cause a critical iron deficit that can seriously impair iron production, leading to a reduction in red blood cells or low oxygen levels in the body. In the end, this may lead to persistent fatigue and exhaustion. Therefore, you should think about the potential that anemia may be the cause of your symptoms if you are experiencing them. Number 4. Shortness of breath. Breathlessness is another complication of anemia or low hemoglobin levels. Lower oxygen levels are more likely to be the consequence of low hemoglobin levels in the blood. The lungs will normally attempt to breathe in oxygen more quickly than usual in order to keep up with the levels that our body needs, which might cause shortness of breath or a faster rate of breathing. Number 5. Dizziness and headache. Your brain and other organs get enough oxygen to function properly while you're in good health. Should there be insufficient hemoglobin in the blood, the brain might not be able to get the necessary quantity of oxygen. This can then result in a number of symptoms, such as headaches and vertigo. Seizures, fainting, brain injury, and other neurological diseases are just a few of the serious symptoms that can arise from dangerously low oxygen levels in the brain. Extremely low hemoglobin levels can also cause a reduction in blood cells, which can lower blood pressure and cause blood thinness. If you ignore this for too long, there may even be deadly implications. Therefore, it is vitally important to take these signals seriously, since they may be subtle indicators of anemia. Number 6. Chest pain and irregular heartbeats. Never take chest pain or palpitations lightly, as there are several possible causes for it. A lack of oxygen in the blood may also result in palpitations or a pounding heart in addition to chest pain. In addition to causing fast breathing, low hemoglobin levels in the blood can also cause the heart to beat more quickly than usual in an effort to get oxygen to every area of the body. As a result, the heart is subjected to more pressure, as it must beat much harder. In the end, this may cause palpitations, irregular heartbeats, and chest pain. Because of this condition's higher severity, Heart failure and strokes may even result. Therefore, you should never disregard these symptoms, and in the event that they arise, get medical help right once. Number 7. Tingling in hands and feet. Tingling may be caused by anemia, impaired blood flow, or insufficient oxygen delivery to the hands and feet. Even in warm environments, it might cause you to feel cold in your hands and feet. In addition to causing muscle cramps, restless legs syndrome, weakness, and weariness, a significant iron deficit, such as iron deficiency anemia, can also result in sleeplessness. Therefore, you should be aware that if you experience any or all of these symptoms repeatedly, and there is no good reason for them, it may be one of the silent signs of anemia that you should not disregard. Number 8. Frequent infections. Additionally crucial to preserving a strong immune system is iron. Lower concentrations of this vital mineral can increase your susceptibility to a variety of diseases and infections. There are two possible outcomes. First, it may impair the spleen's ability to operate, which is an organ that houses our body's defense mechanisms, the white blood cells. Reduced white blood cell counts due to splenic dysfunction might lead to weakened immunity. Secondly, our lymph nodes are negatively impacted by a severe iron deficit in the blood. White blood cells reside in lymph nodes, which also serve to filter the blood of several toxins that might lead to infections. An insufficient supply of red blood cells to lymph nodes raises their vulnerability to infection. It is because of these factors that your body is more susceptible to sickness. Thus, falling ill frequently and for no apparent reason could be a sign of anemia. What should you do if you have anemia? For a correct diagnosis, you should speak with your doctor if you have any of these symptoms. Inquiries on your lifestyle and previous medical history will be made by your physician. In cases when the etiology of the anemia remains unclear, specific diagnostic procedures may be carried out to identify potential contributing causes to the symptoms. A full blood count test is frequently ordered by the doctors. This will ascertain whether or not your red blood cell count is within an average range. Iron deficiency anemia is by far the most common type of this illness. In addition, additional kinds like vitamin B12 and folate insufficiency will be checked for by the blood test. If you have iron deficiency anemia, you ought to think about taking the following 2 actions. First, include iron-rich meals in your everyday diet. Second, supplement your diet with iron-rich foods. Red meat, dried fruits, legumes, and green leafy vegetables are foods you should seek out. Additionally, there are several foods that you should stay away from at all costs, since they may prevent your body from absorbing iron. Brown rice, coffee, tea, milk and dairy products, and peanuts are a few of these. We appreciate you viewing and becoming a channel subscriber. Until the next video, see ya.